just want to introduce you to Harriet. Harriet has been gracious enough to let us videotape her throughout her implant transition. She wants you all to learn from her situation, and she is fine with me explaining some of the not nice facial changes that have occurred to her over the years. She was actually a great patient. She went to her previous dentist every 3-4 months, I think. She's saying she went to the gum specialist, she had root canals done, crowns. She had a lot of work done, but unfortunately she kept losing teeth. And what most people don't realize is as they start losing teeth, the lower jaw starts to drift backwards, and then it starts to close more. And because it happens so slowly over a period of time, people don't realize that as the jaw is closing more and more and more, the face starts to collapse more and more and more. Because the bone relationship is no longer proper, then the muscles start to pull. Even though she's smiling, there's looks like excess skin and there's just a pull in her smile, which is not overly aesthetic. We like to see a nice balance between the portions of the face, and people who are missing many, many teeth often have a collapse this way in the lower third of the face. What many people end up doing is they start going with dentures, okay? And basically, dentures are good for some things, but because you depend on a thickness of plastic, in order to put the teeth in the right position, you would have to bring the teeth out and you'd have to bring the teeth down to correct the facial proportions. Well, if you start getting too much thickness of the pink plastic, you can't wear the denture. Even though the teeth are where they need to be to smile, you won't be able to wear the denture because it's just too darn thick. And that's when people start to build the denture where the teeth are further in and further up. And that's why people get the denture look when they smile. Even though they have brand new dentures, the teeth aren't what most people would necessarily consider aesthetic, okay? And so we're lucky with the technology of implants. The false teeth are supported by the bone. They're not loose like dentures. And so when the teeth are supported by the bone, we're able to bring the teeth further down, further forward to support the lips, to support the facial musculature, and then you get a much more aesthetic smile. And we'll explain more about that in an upcoming video.